what do we as CIOs and technologists do to prepare for this next wave of change, which is already really upon us? And as the phrase goes, and we talked about budget already. Show me your checkbook, and I'll tell you your priorities. The same is true in healthcare IT. Show me your budget, and I can tell you an awful lot about what you value and what you're going to become in the future couple of years. If I were looking at health systems budget right now, there's a couple of things I'd look at and I'd ask, how much are you spending on things connected to the hospital versus new models of care? I see a lot of budgets very focused on the EHR. How many resources are you putting on the EHR, which is predominantly a system to run a hospital or to run a health network. And so much money is being still, even after the big EMR implementations, are still being focused on that. And not enough is being focused on the consumer. How much of the analytics budget is being spent on the consumer? How much of the budget is spent on the changing the way we experience healthcare? And those questions will lead you in the directions. You need to look within the health system. I believe you need to look within the health system and find some people that are doing some interesting consumer-based projects. And it may not always be in the traditional part of the organization, and begin to partner with those guys and look for new initiatives that are going to lead. And this is one of those areas that we lead as CIOs. We identify areas that have promise and utilize some of that margin budget that we have to support those and move them forward.